ReachMD XM157, each hour at this time, presents a special series, Focus on Men's Health.
The implementation of the electronic medical record is something many doctors are still thinking about as something on their to-do list. But there are some medical groups that have been ahead of the curve on this technology and have begun reaping its benefits. Welcome to the Physicians Roundtable on ReachMD XM Channel 157, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter for the Chicago Tribune, and with me today is Dr. Robert Pearl, the Executive Director and CEO of the Permanente Medical Group. As CEO of the largest medical group in the nation since 1998, Dr. Pearl is responsible for the health care of over 3 million Kaiser Permanente members. The medical group is comprised of over 6,000 physicians and 25,000 staff members and operates 19 medical centers in Northern California. And Dr. Pearl joins us today from his offices in Northern California. Dr. Pearl, welcome to ReachMD. Well, it's really a pleasure to have you because Kaiser Permanente has been at the forefront of this debate. And if you could just give us a little background on the medical group and tell us what happens when doctors embrace technology the way Kaiser Permanente has.
My pleasure, Bruce. The Permanente Medical Group is actually this year we celebrate our 60th anniversary. We began when the founder, Dr. Garfield, went to the Mojave Desert to provide care to the workers building the California aqueduct. And since that time, we have provided care to millions of people across all of Northern California, focusing on how can we provide care both that is integrated with the medical group, the hospital health plan working as one, as well as advanced information technology systems. So we've been a pioneer in this now for multiple decades. And today, all of our physicians use an electronic medical record to enter information. And most importantly of all, the people are linked together in ways that provide superior quality and better service far more conveniently to our members. I would probably offer the following model to think about what I call the 4 C's, that the advanced information technology systems are capable of providing comprehensive information. It's capable of providing information that is continuous. It's capable of providing information that connects people together, and it's convenient as the 4th C. From a comprehensive standpoint, the electronic medical record means that we know all of the information about each patient, which allows us to better advise them about the tests that they need in terms of the preventive care. It means that we're best able to make the comprehensive diagnosis as we can bring together the information from primary care and specialty care. And it means that we can tell the patient what they might do to improve their health going forward. From a continuous standpoint, it means that we have the opportunity to provide care every day using electronic tools. As an example, patients with heart failure would enter information, and do today, into the medical record that allows the physicians to know how well they're doing, whether they're having added swelling in the ankles, whether they've gained weight, and therefore we can intervene more rapidly should they require care before they go to the emergency room and before they're admitted to an intensive care unit. We're able to treat that on an outpatient basis. By connectivity, we're able to take information from the medical offices to the emergency rooms to the hospitals. We're able to link together a primary care physician and a specialty physician. As an example, the EKG that I had done in my physician's office would be available in an emergency room, in fact, in every emergency room across Kaiser Permanente, so that physicians can compare the new EKG that I've had after I have chest pain against the old one and much more rapidly make a diagnosis of a heart attack and begin treatment, should that be the appropriate response. And then finally, in terms of convenience, the fact that all of our members can email the physician. It's free. It goes directly to the physician. We receive about 3 million emails a year and are able to provide care to patients from their home. They can order medication refills electronically and have it delivered to the house. They can schedule visits, select a personal physician, get medical information. In the age of the Internet, we need to use the 21st century technology to solve the modern problems, or healthcare will simply not be able to address the aging of the population and the growing incidence of chronic illness.
Well, Dr. Pearl, you bring up several interesting things, and for our listeners out there, whether they be a physician in the field or hospital leaders or even consumers, they're probably thinking, my goodness, being able to email your doctor, I mean, that's something that still isn't done in this country where you, by and large, can't email your physician. So just how long has Kaiser Permanente been doing electronic medical records? And just generally, how long have your members been able to email doctors?
We began this process actually over 2 decades ago, putting in electronic medical record systems. In the earliest time periods, the technology that existed within the computer world was not sophisticated enough to handle the large size that our membership requires. So it has been a process in evolution. About a decade ago, we began having available to all of our 6,000 physicians, although at that time we had a lower number as our membership has grown over the course of time. But we made available all the pharmacy information, all the laboratory information, the details on the diagnoses that physicians made in the medical offices. And that's evolved over time so that now, as I say, all of our care is done in an electronic fashion, and our physicians embrace it. In fact, it's one of the major reasons why today we have 8 applicants for every opening in our medical group because people want access to this type of advanced information. We began the email your doctor process about 2 years ago, and I should make a point for your listeners, which is that this is different than when we think about the regular email you do on your desktop computer. This is through secure servers that guarantee privacy, that have all of the protections that are crucial to patients in terms of the medical information that they'll be transmitting. But we call it email because that's what it looks like to the individual who would be doing it. And about 2 years ago, we started, and every month the numbers increase. And as I say, right now, we will do about 3 million emails this year. And it goes directly from the patient to the physician's desktop. The physician may then ask one of the nurses or other individuals in the office to assist in solving the problem, but we want the communication to go directly from the patient to the doctor.
And so it's something that's set up via secure systems, so if I were a Kaiser Permanente member, I could access it on my home computer? It's
the same way you would do your financial management from home, with the same protections the banks do today. So it does go through secure servers. And that's correct. Any place that you are in the world. In fact, we have patients who've emailed from the South Sea Islands when they had a particular problem with a creature in the ocean, and were able to not only email their question, but email a picture and have the physician in Northern California make the appropriate diagnosis and make the appropriate recommendation of treatment.
The South Sea Islands, you might get some great patients there.
Well, they lived from here, and they were traveling down there and scuba diving when they stepped, I believe it was on a sea urchin.
Well, this is very interesting. If you're just joining us, or even if you're new to our channel, you're listening to ReachMD XM 157, the channel for medical professionals. I'm Bruce Japsen with the Chicago Tribune, and with me today is Dr. Robert Pearl, who's the Executive Director and CEO of the Permanente Medical Group, which, of course, is affiliated with Kaiser Permanente in Northern California, and they have over 6,000 physicians, which would make it the largest medical group in the country. And we're talking about electronic medical records. Now, this is a phenomenon that is still, unfortunately, just beginning for a lot of doctors and hospitals and medical groups across the country. But Kaiser has been at this for a decade or so, and we've been talking about emailing patients having the secure ability to email their doctors. And one thing, Dr. Pearl, that you already brought up that I think is fascinating is that there are a lot of physicians who are a little scared about this because, they think it might be an annoyance and so forth. But when you were talking about the applications and people wanting to apply to Kaiser, what are some of the notions that need to be debunked for doctors and patients about either an email system or electronic medical records as a whole that they really don't need to worry about?
Well, I think in terms of the debunking that they should be not worried about would be that in organizations like Kaiser Permanente, that we are able to protect their privacy and their data very well. As I say, we use the same exact approaches that a bank would. So to the extent that you're willing to put your financial information through the computer system, you'd feel comfortable putting your medical information through the same type of system. But I think the more important component, Bruce, that you're raising is the difference between what happens in what I would call the fragmented fee-for-service world and a integrated organization like Kaiser Permanente. And this is, I think, why, to your point, so few physicians have the access to advanced information technology systems and are able to fully utilize the Internet to provide care, which is that for physicians in the community, these things often compete with their ability to be paid for the services. Whereas an integrated organization like Kaiser Permanente, particularly because the majority of our members are prepaid, it actually is advantageous to the patient and also works well for the physician. If there's a myth about it, it's that these systems are very difficult to use. We certainly provide training. It takes several days of training for our physicians, but they're not particularly difficult to use. The most important part is getting the value out of them. So as we spoke before, as an example, if you don't have the entire medical record, all the full set of information, you simply can't give the same level of quality that you can when you have all of that information available to you on a single computer screen. Many of the physicians who come to us simply say, we want to practice the best quality medicine, and we can't do that outside of an organization like Kaiser Permanente. The second thing is that you need to be able to build it into the way that you provide your care, so that it should not matter whether your patient is in your office or at home. You're able to receive the medical information, obviously make a determination when you need to physically see them or physically intervene, but that opportunity to make the systems more convenient, to be able, well, I'll give you an example. There's a patient I just got a letter from who had a particular medical problem, called their primary care physician to come in and be seen. And because the computer systems allowed the primary care and specialty physician to communicate, they could go from the primary care physician's office to the specialist's office that was in the same building. On the way, they went to the radiology. By the time they got to the specialist's office, the X-ray itself actually was available on the specialist's screen. The specialist made the intervention that was required, and by the time the individual got to the pharmacy, the prescription was ready. The entire set of care was done in about an hour and a half that would have taken, based upon this letter, 3 to 4 or 5 days in the general community around. But that requires the integration and the organization as part of being able to use the power of technology today.
Well, you bring up some interesting points because a lot of organizations just are not there yet. But this is clearly, this could be done. This could be done in a community system with one hospital and one medical group. Or are there unique things to Kaiser that makes it easier? Can this be done easily out there for the rest of the country?
I'm not sure I'd say that it can be done easily, but you're absolutely correct. It could be done if people had the will to do it. There are structures that exist in the communities, particularly coordinating the medical groups in the community with the local hospital. They could all adopt the same technological systems. They could be willing to share the data and information which they have. I have an optimism that the medical world will see the opportunities and will make the change once they understand the qualitative and both quality and service advantages which ensue.
I would like to thank Dr. Robert Pearl, who has been our guest. He's the Executive Director and CEO of the Permanente Medical Group. I'm Bruce Japsen with the Chicago Tribune. I've been your host. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions on today's show through our website at reachmd.com, which now features our entire medical show library in on-demand podcasts. And I would like to thank you today for listening.
Listen all month as ReachMD XM 157, the channel for medical professionals, presents a special series, Focus on Men's Health.